is that the CCOs have bent the cost curve in beginning the process of integrating our healthcare system across a spectrum of care as it was designed. But the program clearly needs to be updated, and the next chapter of Oregon's healthcare transformation is still waiting to be written. We truly need that next chapter of CCO development in Oregon. Unfortunately, without the leadership of this legislature and the governor, progress has stalled. I think we all saw the recent news stories this summer that demonstrated the need for greater transparency and certainly greater accountability. And without a clear vision for what the future of healthcare reform looks like in Oregon, CCO efforts to innovate and deliver care beyond traditional methods have sputtered and slowed and are near stopping. In particular, investments in social determinants, which have been described by both Democrats and Republicans as one of the key components of the CCO vision in leading this next healthcare transformation, have been inconsistent, poorly defined, and really disincentivized by an antiquated rate-setting process. Without new thinking, a new direction, colleagues, CCOs are now at risk of turning into 15 small, traditional, for-profit insurers spread across our state. This minority report maintains all the provisions of House Bill 4018. Let me say that again, colleagues. This minority report maintains all the provisions of House Bill 4018, which were championed by Representative Greenlick. However, this version includes two of many, many amendments that were proposed to move CCOs forward and deliver better health care for Oregonians. This minority report does two things. The first is that it requires that we actually study in the interim. We actually study, wouldn't that be nice? Study in the interim our upcoming $1.5 billion Medicaid budget deficit, which we will all have to deal with in the 2019 session. And it will not be easy sledding. That's a big hole to fill. Wouldn't it be nice that we actually look and think about it in the interim so we come here with good solutions in hand? And it does a second thing. And secondly, it directs the Oregon Health Authority to set aside a portion of the CCO's global budget for investing in social determinants, creating corresponding metrics for those investments, and clarifies exactly what a social determinant is, what a spend, what an investment on social determinant really means. As I've traveled around the state and talked to CCOs, investments in social determinants varies widely. The amount that they actually spend on social determinants varies widely. And we even heard in committee testimony that one CCO thinks that social determinant investment is funding and sponsoring a Little League baseball team. Now, someone who's played baseball, I appreciate the commitment to fostering baseball, but I don't think any of us really had in mind that that's what social determinant spending would mean. Now, carving out a portion of the global budget for investments in social determinants ensures that sufficient funds are being directed towards those interventions. And CCOs now, with this change, wouldn't be punished in the rate-setting process by a funding formula and a medical loss ratio that does not account for these types of investments. By defining social determinants, we help prioritize investments and show clear legislative purpose. And importantly, there's connective language in this amendment to maintain Oregon's consistency and connection to the 1115 waiver and CMS guidelines. Now, colleagues, why is this important? Why does investing in the social determinants even matter? Because physical care is only one small part of what makes us all healthy. Safe and affordable housing, quality education, livable wages are also critical to living a healthy and fulfilled life. Now, this may sound odd coming from a surgeon, but as I've grown older, I've realized that there's only so much I can do for my patients in the operating room, and many, many people need so much more than what we've been able to give them in this state. Clearly, this is a small step. House Bill 4018 and the Minority Report, they're small steps towards writing Oregon's next chapter in health policy. But it's important to refresh Oregon's reputation as a bold innovator in healthcare. Creating healthcare policy in Oregon has a long and proud bipartisan tradition, and that's at risk. We have an opportunity with the Minority Report to work together, taking good ideas from both Republicans and Democrats to improve outcomes for all Oregonians. And so, colleagues, I hope you'll join me in supporting the Minority Report. Thank you, Madam Speaker.